Hi, everyone. I'm Amy Zelmer from Faces of TBI, and welcome back to the Brain Health Online Summit Training Series. I am a TBI survivor from a fall on the ice of February of 2014, and myself, along with Dr. Jeremy Schmo at Minnesota Functional Neurology, we saw a need in the brain injury community for more training and education on alternative healthcare methods and modalities for those suffering from the lingering effects of a brain injury. So our goal is to help educate and bring awareness to this invisible injury that affects 2.8 million Americans each year and is the leading cause of death and disability in the world. So each day you will be hearing from 4 to 5 speakers who are going to share their experience either working with brain injury patients or their own real-life experience of living with the brain injury. So today I am here with Dr. Ryan Cedarmark. He graduated magna cum laude from Life University in 2011, becoming an honorary member of the Chiropractic Honor Society, Pi Tau Delta. While in school, Dr. Cedarmark enrolled in postgraduate neurology courses, earning his diploma in neurology from the American Chiropractic Neurology Board in 2013. Passionate about a multidisciplinary approach to healthcare, Dr. Cedarmark graduated magna cum laude with his Bachelor of Science in Nursing from Duke University and is currently enrolled in a family nurse practitioner program at Georgia State University. He is a clinician at Vital Life Health Centers, and his multidisciplinary educational background creates a unique approach in today's healthcare environment. So welcome to the summit, Ryan. I'm so thrilled to have you here.
Hey, thank you so much for having me, and thanks for putting this on. I love that we're raising awareness for this stuff, and it's something I'm really passionate about, so thank you.
Yeah, and I'm real excited to hear you talk about, today we're going to be talking about the effects of traumatic brain injury on the gut-brain axis. So yes. I'm real excited to hear what you have to say. So I'll kind of let you just jump in and get going.
Awesome. Thank you so much. So one of the things I noticed when we would have a lot of our concussion patients and post-TBI patients come in is that they would have some sort of gastrointestinal dysfunction symptoms like bloating, gas, inability to tolerate foods that they used to be able to tolerate, things of that nature. So I started to dive a little bit deeper into the research on what happens to the gut when you bump your head. And there's some really good literature out there, and I think this is something that people are really starting to look into a little bit more to try and figure out how we can make positive changes to not only the brain after TBI, but the effects that it had on the gut. So without getting too scientific-y, I just wanted to kind of go over when you do hit your head, what happens. You've got your brainstem, and I'm going to use my thumb here, kind of like the brainstem, and then you've got your brain sitting on top. So if you think about it, there's a big highway of communication just between your brain and your brain stem. And when you hit your head, there's a lot of movement going on with your brain inside your skull. And what happens is that movement will change the communication between the brain and the brain stem. And the reason that's really important is because a lot of really important things happen when there's communication when there's proper communication between the brain and the brain stem. So things like there can be an axonal injury. So it's basically, if you think about it, just some highways that you're used to driving down that are free of traffic now become kind of full of traffic. Does that make sense?
Yeah, that's a great analogy.
And one of the major highways that get affected after a TBI are the cortical, so the brain, and then the pontine, which is, I call it the belly of the brain stem, the corticopontine highway. We'll call it a highway. And that's important because our vagus nerve centers, our vagus nerve nuclei, which is our rest and digest nerve, is sitting right in that belly of the brainstem, the pons. So after a TBI, the literature has shown that there has been some issues in communication between the brain and the brainstem. So that's one of the reasons why I really got interested in this, because the brainstem has a lot of communication that happens between the brainstem and the gut. And a majority of that communication is through the vagus nerve. So if we've bumped our head, then we should automatically kind of assume that there might be some sort of damage in that communication pathway or a lot of traffic going on. So that's pretty much why I got into studying about the gut-brain axis and then looking at what could happen and what a patient may present with if they do bump their head on a level of the gut, so to speak. So, and if anyone's not familiar with the gut-brain axis, basically what we're talking about is the brain and then the gut and then the communication between the two, because there's constant communication going on. And if there's good stuff happening in the gut, there's usually good stuff happening in the brain and vice versa. So injury to the brain can equal injury to the gut. And that's pretty much my little spiel on the gut-brain axis and traumatic brain injury, but it gets really deep if you guys want to go a little bit deeper.
So, I mean, I hear a lot about this, about how when you hit your head, it can very much affect your gut and digestion and all of that. So you kind of slightly hit on them earlier, but what are some of the main things one might see if they're having problems?
Sure. So just to cover a couple of them, the first one that we may see is an imbalance in their sympathetic versus parasympathetic nervous system. So when we talk about your parasympathetic nervous system, we're talking about the rest and digest system. And the majority of the time, we should be living in our parasympathetic nervous system because really good things happen during that time. We're able to rest. We're able to let our body heal. Communication is allowed to take its time and just make really good communication between specific areas. So we really like to see a lot of parasympathetic activity. The sympathetic activity is your fight and flight area. So when we see someone that hits their head, we'll see something called dysautonomia, where there's a dysregulation in the autonomic centers of the nervous system. And typically what we'll see in patients is there's an increase in sympathetic activity. And physically, that can present as increased sweating, increased heart rate, changes in their pupil responses, changes in their musculature. They can come in and have very tight musculature that they normally wouldn't have because they're kind of in that fight or flight mode. So it's things of that nature that we start to see. And when we see dysautonomia in a patient, I automatically think we should be looking at the gut, because if we're resting and digesting properly, our gut's able to work really, really good. And it needs to be in a parasympathetic state so it can digest foods properly and all those things. So if we hit our head and we're in more of a sympathetic state, we can develop all different sorts of gut issues. So one of them is dysautonomia. That's a really, really big one. And clinically, from a functional neurology standpoint, we can see that from all those different types of things. So that's one of my big ones.
And I do think, a lot of people I meet in the TBI world, they are living in that fight or flight mode. They have a lot of startle reflex, just they're constantly always just kind of like agitated. And when you're so what you're saying is when you're in that fight or flight mode, that's affecting your digestion.
Mm-hmm. Mm-hmm. Yeah. Like a good way to think about it is if you're sympathetic, so if you're in the fight or flight mode, your brain doesn't really care about digesting foods properly. It's more
to protect you.
Yeah, it's more about trying to shunt blood to the peripheral musculature and shunt blood up to the brain so that you're aware of your surroundings a little bit more. You're able to move faster if you need to move faster. And so your gut kind of gets forgotten. And some things can happen when that happens. You can start to decrease the motility in your gut if you're living in more of a sympathetic state. And that's important because if you decrease the motility, which means if you decrease proper gut movement, you're decreasing the ability to adjust the appropriate food substances, and you can get a buildup of the things that are supposed to kind of pass through. So that's a big one. So we start to see things like intestinal permeability in patients. So that can present as patients not being able to tolerate foods that they used to be able to tolerate. And there's really good testing that you can do to look into that. So intestinal permeability is another one.
Is that why broccoli tries to kill me now?
Yeah. So did that happen to you?
Yeah, I can't eat broccoli anymore. I used to love it, and now I can't. It just makes me want to die.
It's like every kid's dream. They're like, oh, I don't want to eat broccoli anymore. But yeah, sometimes it happens. So what can happen is we can go a little bit deeper into this. In your gut, you've got gram negative and gram positive bacteria. So you've got these really good bacteria hanging out in your gut that are supposed to go in and work. You guys have heard of good probiotics and things like that. So there's good bacteria in your gut, but there's also bad bacteria in your gut. And sometimes the good bacteria can turn into bad bacteria. For example, there are things called lipopolysaccharides that help make up the bacterial cell wall. And when we have damage to our brain and we get decreased motility in our gut, or we get decreased blood flow, we start to develop inflammation, and those little cell membranes of the good bacteria break away and they become inflammatory. So they cause all these different sorts of problems. And when they become inflammatory, our immune system goes into alert mode and it starts to go after those things because they're foreign objects. And the problem with that is sometimes our immune system gets a little bit confused because hopefully it's been on vacation and not had to work too hard. And it sees these lipopolysaccharides that are now bad guys and it attacks them. But then it's also like, well, hey, what else is that? Hey, what else is that? And so it can attack things like broccoli or something like that. And so all of a sudden you're like, oh, I'm going to eat healthy. I'm going to eat broccoli. And then boom, you have some sort of reaction to it, like increased heart rates, maybe some sort of skin expression that you never had before. So things of that nature. And that's rough because then you got to dive a little bit deeper and say, how do we fix the gut? And the big thing is we've just got to look at the brain and say, okay, we've got to work on the brain because there's some mixed communication and some traffic going on there. We've also got to make sure that we're paying attention to the gut, because if the brain's bad, gut's bad, brain's bad. And it's pretty simple like that. Well, it gets less simple, but.
So what are some things we can do to improve our gut health?
So there's good research now showing that if we can increase vagal stimulation, I'm not sure if you've done this before, but have you ever done any vagal stimulation?
I've done the gargling.
Okay, cool.
Yeah.
So there's a couple of really good things you can do to activate your vagus nerve, because remember, your brain is going to talk to your brainstem, and then that's going to fire up your vagal centers, and it's going to make your vagus nerve more aware of your gut and what's going on with your gut, and so it's going to increase good gut function. So one of the things you can do, like you said, Amy, is gargle. And so we'll have patients gargle throughout their therapies. Maybe not so much in public. It's becoming a thing now, though. So like we'll go out to the restaurant and have patients gargle. No, I'm just kidding. But one thing you want to do when you gargle is you want to make sure you gargle and really activate those centers. So sometimes we'll have patients do a gargle and they'll just go like, ah, really low and slow, and you're not getting as much activation. It's just like if you tried to work out your bicep, if you lifted up like a 5-pound weight compared to a 50-pound weight, you're going to get more activation. But we've got to find the right activation. So a good rule of thumb is when you're gargling, you can gargle to a point where you may even tear up a little bit, because your gargling centers, those vagus nerve centers, are really close to your facial nerve centers, and part of the facial nerve is going to go out and create some tears. So if you're gargling to tears, that's actually a good thing. You're getting really good vagal activation.
Yeah, I think when I gargled, like I kind of tipped my head back, and like I want to say I did like the alphabet. I like kind of sang the alphabet song as I gargled.
Ooh, that's a good one. I haven't done that.
Yeah.
So Dr. Schroeder to make you cry. That's good.
Actually, the reason he had me gargling was to stimulate the nerve, but for my headaches.
Awesome.
And it would actually help relieve my headaches pretty quickly.
So that's actually a really good point, because we think about gargling activating the vagus nerve, but it has so many functions. If we can increase that parasympathetic activation and increase more excitation of the parasympathetic side of the nervous system, you can shut down a sympathetic response, which may express itself as a headache, right? Mm-hmm. So we have patients who have pain or nausea. We'll have them gargle as well, and it'll help. Not only will it help their gut, increase the communication between the brain and the gut, but it'll also help with some of those over-sympathetic responses that we don't want to see. So that's pretty cool.
And like it's easy. I mean, you can do it kind of anywhere. I mean,
yeah.
If you want to do it in public,
yeah, you can.
You can kind of do it anywhere, just it's a real easy tool.
super duper easy tool. And yeah, just regular water. So like you said, anywhere. One that you cannot do anywhere is a coffee enema.
No, you can't do that anywhere.
Yeah, I mean, it depends on your personality, but that's another good one. So like, I always like to think about taking the top down approach, but also the bottom up approach. So doing a coffee enema can actually help stimulate vagal activity as well, because what you're doing is you're inserting your coffee into your rectum. And the caffeine in the coffee is actually going to activate nicotinic receptors in your gut, which is going to increase motility. So if motility is an issue with patients and they're having constipation or anything like that due to their traumatic brain injury, we can have them do a caffeinated coffee enema. Of course, like the coffee has to be clean, healthy coffee, like gluten-free coffee. But you want them to do that, and then you want them to get to a point where they're really, really struggling to try to hold that coffee in, because as you do that, you're really driving your corticopontine vagal system. So you're really driving that pathway and exercising that pathway, as opposed to just putting some coffee in and letting some coffee out. The ability to hold down and bear is a huge brain exercise. So that's a really good bottom-up approach that you can't do at your restaurant.
No.
but another really good one. So yeah, we don't do those in the clinic either. those are required homework exercises.
So what else besides the vagal nerve? What else can we be doing to
So a big one is we've got to try to reduce inflammation in our environment. And that can be a difficult thing. Like you said, sometimes you're unaware of what can be inflammatory. Who would have thought that broccoli could be an issue when you have a traumatic brain injury? You would think broccoli is actually good for you because there's antioxidants in it and good vitamins in it. But so the one thing you can do is be aware of your body, be aware of the responses. And this is the easiest way to do it. And we tell patients, eat a food, and if you have some sort of sympathetic response to it, like if you have increased heart rate or you just don't feel great, increased brain fog, eliminate that food from your diet. And another big one too with vegetables, just kind of going down that rabbit hole, is you gotta try to purchase organic vegetables, and not just to be organic, but because they're spraying stuff all over our good foods now, and our immune system doesn't like it. It's not a natural thing for our immune system to see. So if our immune system is already on alert mode and you put some stuff like glyphosate or the Roundup stuff from your vegetables into your system, your immune system is just going to keep going after stuff that it shouldn't go after. So eating good foods, being aware of the foods that you're eating, but then also looking into getting on some supplementation that may help your brain. I don't know, did you get into any of the supplementation with?
A little bit. Mm-hmm.
Okay. One thing I'm really looking into now is obviously we want to remove stuff from our diet, remove toxins from our diet that may cause inflammation, but we also want to put good things in. And one good thing you can put in is you can put in good essential fatty acids. So like a really, really good fish oil. And there's so many good ones out there, but doing a really good fish oil to help with that cell membrane and make all the cells really nice and strong again. And it's just good fats for your brain as well. And also getting on a good probiotic so that the intestinal inflammation can slow down. There are some probiotics that are of like a spore component, and those spores will actually go in and they'll tell those lipopolysaccharides that are causing an immune response to just go on vacation. So getting on a really good probiotic and getting on some good essential fats are really good things. Taking supplements for good brain blood flow, just like something called vinpocetine, stuff like that, that's been shown to really help with good, healthy brain flow to get good stuff in there and help clean out the bad stuff. So that's another good thing.
Mm-hmm.
So.
Yeah. And I know with Dr. Jeremy, he did a full blood workup with me to see if there were any underlying problems going on. And I can't remember what he put me on, a B vitamin and a it's basically turmeric.
Okay.
Yeah, but it was
turmero from one of the companies.
Yeah.
Okay, yeah.
That was it.
Yeah, and actually, like the liquid anti-inflammatories seem to have, and I think those liquid anti-inflammatories like turmeric or turmero is also kind of like together with some essential fatty acids. So that's a really good one to take. How did you feel after you took it?
I think I felt really good. I mean, it tasted good too. Like I was surprised. I was like, "Ooh, this looks really gross."
Yeah, you're supposed to get it on your shirt. I think that.
Yes, yeah, it's bright orange. It looks like carrot juice or something. Um, and then my girlfriend got me hooked on doing a shot of apple cider vinegar with turmeric and ground pepper in it.
Ooh, that's awesome.
Brave, but
Yeah,
you know,
I mean, the apple cider vinegar alone is intense.
yeah, exactly. But that's been like, I've really been enjoying that. I'm feeling a difference in my body just by doing that.
Oh, that's fantastic. I haven't dove into the apple cider vinegar, but definitely something I'll look into. That's great. Yeah, any type of supplementation, and you mentioned blood work. I think that's really important for people that have post concussion or post TBI symptoms that haven't really resolved the way we want them to resolve. I think that you really you need to look at the metabolic side of things and say, hey, is there inflammation? Where is the inflammation? Did this person who had a traumatic brain injury have an underlying anemia that wasn't really addressed? So they already had poor circulation, and now you've got this injury. So it's almost like an insult to an injury. Or do they have some sort of dysglycemia? So, when we talk in functional neurology, we talk about how important it is for a cell to have stimulation. So that could be in the form of like a chiropractic adjustment, an exercise, physical therapy, anything of that nature. Good glucose and good oxygen. If you don't have those three things, your cells are already at a loss, and they're basically working pretty hard when they shouldn't be. So looking at blood work, and then also diving down the road of looking into altered food responses. You can do food testing, looking into stool testing once we know that the gut has become a problem and it's not clearing up, looking into those things to see if there's pathogens that are creating the inflammation. So getting blood work done, I think, is pretty essential, especially if people are having lingering symptoms.
Mm-hmm.
And honestly, getting blood work done from someone who's trained in looking at it from a functional medicine perspective, because if you do go the traditional route, they may just tell you, hey, everything's fine. And that can be really frustrating for patients. And we've seen it all the time where, maybe pathologically they're not in an anemic pattern or a dysglycemic pattern, but functionally we can see, hey, this is actually driving some inflammation, and now your thyroid's acting a little bit silly, and then your gut's acting a little bit silly, and that might be the cause of it. So looking to someone who might look at things at a functional level could be the best thing.
And I know a lot of people are doing like gluten-free, dairy-free with their diets. What has been your experience with that?
Yeah, are you gluten and dairy free, or really? So how do you feel?
I don't know. I think I feel okay.
So that's a tough one. I preach that, especially anybody who has had a TBI or a concussion. I think going back to addressing the inflammatory component and removing toxins from our diet is a big thing. And I think two big culprits are gluten and dairy. The proteins. So let me back up. When you have a TBI, the literature has shown that you have a breach in your blood-brain barrier as well as a breach in your intestinal barrier. So what that means is you've got, let's just say, a screen door episode for the brain. You've got a screen door that allows good things in and keeps all the flies out, okay, for your brain vasculature. Now, when you have a TBI, the screen door gets a couple holes poked in it, and now you've got little flies and things flying into your screened-in porch that are annoying the crap out of you on a Saturday afternoon. And the same thing happens in a TBI. You've got these little bugs kind of coming in when they shouldn't come in, and they're causing all sorts of inflammatory responses, altered communication, and just trouble overall. So you've got issues with your brain, and then the gut. You've got a really good gut layer that allows good little things to trickle in, and then the bad guys kind of to pass through and make their way out of your system. When you hit your head, the research has shown that you've got intestinal permeability. So those little villi open up, and now the big guys that are cruising through, and paid no mind to that area are now like, hey, what's down this door? What can we go into? They get into your system, they get into your blood system, they cause an inflammatory response, and they actually can make their way up to the brain. So going into gluten and dairy, I think removing things that have been shown to be inflammatory in nature are best for you. So if we can get a patient off of gluten and dairy, that's like my favorite thing to do. There's so many good options out there now. You have to be careful because sometimes they'll load gluten-free foods with sugar and other bad things. But just kind of going the sort of more vegetables, more protein route if you're not a vegetarian or vegan, and removing cow's milk and bad things like that can help. So I don't want to go on like a gluten dairy binge, but I think it'd be better if we stayed away from it just in general, especially if you had a TBI.
Mm-hmm.
But no offense, I understand bread's awesome.
Gluten's great. I actually have an easier time eliminating the gluten than the dairy because I'm a huge yogurt-aholic.
Ooh, what kind of yogurt?
Greek God is the brand. It's just
okay.
Greek yogurt, but
so what's that?
I love yogurt.
Oh yeah, I do too. Like I used to work in the hospital, and that would be like my 11 a.m. I'm gonna get a little bit of yogurt with some cashews and honey in it.
Yep.
But I started to notice, and the same goes for gluten for me, and I don't think this is a hypochondriac response, but when I eat dairy, especially yogurt, I start to get itchy all over my skin.
Oh, weird.
Yeah, I get really itchy, and there's antibodies that you can develop against your skin, your brain, and your gut when you eat things like dairy and gluten. So if you're having a symptom, like if you get an increased heart rate, if you get itchy, like my wife will crack up if I'm like eating like a sandwich and then finish up with yogurt because I'll walk around the house like, but it was so worth it. So if you experience any of those things, especially after a traumatic brain injury, you just want to be mindful of that because, again, removing the bad things and putting in good things can be a really good thing for your brain. And we've only got one of them. So.
Mm-hmm. And I think it's hard, you're dealing with a brain injury, you're dealing with a new you're dealing with so many things. And, because this is a complaint I hear a lot, is it's hard for people to switch up their diet. I mean, change is hard when you have a brain injury to begin with.
Oh, yeah.
And, like the doctors want you to try supplements and to take out gluten and dairy. And like, it just gets really challenging for some people.
Oh my gosh.
What would you like, what's an easier way of doing this? If there is one, does that make sense?
Yeah. So it's funny. I was talking to Kevin Ballister. I think he's doing this. And I asked him a similar question because, I've never suffered a traumatic brain injury, but like I have trouble breaking habits, it's the nature of the beast. So for me, what I like to do is you've got to know your patient's personality. If they've had a traumatic brain injury and they're also kind of OCD about stuff, you don't want to take everything away from them because then they're not going to eat anything. And that may not be good for them because we need some nutrition. So for me personally, what I like to do is I don't like to take the shotgun approach and say, you've had a brain injury, stop everything and let's fix stuff because you're already overwhelmed, like you said. We like to try to start low and slow. And I think when people start a little bit lower and slower, they start to see a little bit of the benefits.
Yes.
Things just kind of become more of a lifestyle thing. And that's my biggest thing that I like to tell patients is don't think of this as a huge thing. Let's just start this really low, really slow, and let's just gradually build. There are patients that are like, I'm stopping everything, never touching, a piece of bread again. And you're like, cool, like more power to you. You're amazing. Can you help me fix my brain? No, but there are patients, and the majority of people I think that I've experienced, we've got to start low and slow because there's just so many things going on. And gosh, like trying to be social on top of that, like, hey guys, you want to go out on a Friday night? Yeah, but are we going somewhere that has no gluten, no dairy, and is autoimmune? And they're like, no, you're weird. And then you're like, oh man, then that puts patients at risk for being in isolation, right? So for me, the big thing is just starting low and slow and just working our way up.
Little baby steps.
Baby steps, yeah. So,
I know in the beginning when I started supplements, like I literally made a list of when I was supposed to take which ones and during the time of the day. And like I sat it on the counter where I should see it. And like I would just forget. And I'd go 3 days without taking my supplements. And it was, it's so frustrating because our memory, like people just can't comprehend this memory thing that we deal with. Like there's this lack of awareness. And Jeremy would be like, did you take your supplements? Like, crap, I forgot again. And it's not that I didn't want to, it's just that I would just keep forgetting. And so I've tried all sorts of tricks. Like I've put a sign inside my fridge so when I open it, and in the cupboard where I make my coffee, putting something right there so I see it. But there's so many challenges with the brain injury.
I know it's ridiculous. And more kudos to you. And that's the one thing, like I make sure I try to like just reiterate all the time is if you forget something, it is not a big deal. Mm-hmm. Like you're already doing all these good things for yourself that if you forget something, don't worry about it, because what you don't want to do is drive a stress response that's going to drive inflammation, that's going to screw up your gut and your brain again, and then you're going to be back at ground zero. So just don't worry about it. Forget about it.
So what else about the brain gut did you want to touch on?
That's mostly it. I just, I really wanted to talk about the brain gut, and thank you so much for letting me talk about it, because I just wanted people to kind of be aware, because I feel like we're doing so many good things in the field of traumatic brain injury and post-concussive injury and making it more aware. But I just really wanted to make sure that people are reminded that we do have a second brain, and our second brain is our gut. Yeah. And even though we've bumped our head, our brain is in control of so many important things. So, and one of the really important things is your gut. So I just really wanted to just raise some awareness, and then, talk about some of the things that can happen. And like we talked about, just go over some exercises people can do to make them better. I'm pretty sure that's all I really wanted to touch on. Do you have any other questions or anything?
No, and I really appreciate it. All your analogies. That's helpful for people. I think too often doctors try to explain things in such medical terms that it's challenging to understand. So I appreciate your analogies to try and help make it more understandable, with the screen door and the flies getting through, and yeah,
thanks. Actually, you did remind me of one thing. I do want to tell people, like anyone that's listening, we've had, like, for instance, this week, we had a young girl come in. She's had like 4 concussions in the past 3-4 years. She's a horseback rider. And they literally, the first thing, they actually came in for a chiropractic appointment, but our chiropractor referred them over to our wing. And, she just had so many different eye movement issues. She had brain fog. She couldn't turn her head to the right. She has literally been to, I don't know, like 6 or 7 doctors that have basically kind of wrote it off. Not to say that everybody does that, but I don't think people really understand what functional neurology is. And looking and saying, yes, there is something there, but there's also all this alteration in function. So if you've had a traumatic brain injury or you've had a concussion, don't think that it's all in your head, because it's not. There's so many people out there that can help you. And there's so many good practitioners that are starting to look at this at a functional level, and they're also implementing some nutrition if that's what you need. But, make sure that you don't get down on yourself if you just haven't found the right practitioner, because there's a ton of people out there like Dr. Schmo, and some of the other speakers here that can at least look at you and say, hey, there is something wrong. And I think that's a big thing for patients to know, yes, there is something wrong. Like, I don't understand how some of our patients have been doing what they're doing for so many years, performing at a high level and walking around with really bad vertigo. It blows my mind. So I just wanted to kind of make that point. And also, eat your fruits and veggies, except for broccoli if you're Amy.
Except for broccoli. And, I thank you for saying that, because, that is our whole point of doing the summit, is to really just help expose people living with a brain injury or their friends or their caregivers, and just giving them more resources, because there are people out there who understand this and do know how to work with you.
Mhm.
And if you keep getting brushed off, I was brushed off for 2.5 years. Just, I kept being told, with my eye stuff, well, your eyes are fine. My memory stuff, well, that's just going to be something you have to live with.
That's
And, I knew that there had to be someone out there. So I was really thankful when Jeremy found me. But
yeah, you got a good one.
yes. And anyone in the Twin Cities needs to call Jeremy. But you guys are all over and all over the country. And, we just really want to show people options of what's out there, and that you don't have to keep struggling. And no matter how far out you are in your injury, there's still treatment available.
Right. There's so many
There
out
are
there.
doctors who say, oh, 2 years, too bad, you're done, you're not going to improve.
I know, and it that's what really like pulls at my heartstrings, because you have a 20-year-old, a 25-year-old who's pursuing all these things, and this is their future. So
Yeah.
we just have to be mindful of really trying to dig in deeper, and what can we do as practitioners to figure it out. It's very humbling, like functional neurology is still very, very new, um, as compared to other things in the healthcare world. So that's the cool thing about it, though, is we're finding out so many good things and so many applications to help fix neurology and to help fix things like that. So yes, please, just anything you need from any functional neurologist, you can reach out to one. If we all pretty much know each other, so.
That's what I love too, is you guys are just so happy to help someone find someone else closer to them.
Yes.
And Ryan, you do have an offer for our listeners. You have a free 30-minute phone consultation.
Oh yes. Okay, we're not doing the coffee enema one. No, I'm just kidding.
That's
Yeah.
hard
So,
to do over the phone.
my practice is located. So I work in a practice that's associated with Life University. Dr. Reekman, the president of the school, opened up a clinic in Midtown, and we're fortunate enough to have a whole neurology wing and an on-site lab draw. So I would love to speak to you. If you need anything, you can call my office, and I'd love to set up a 30-minute free consultation. And that can be just to kind of try to figure out where we can help you go if you need help. Because, I myself am always reaching out to find practitioners that are local for people if they don't want to travel. But also we offer, people come in from all over the country to come and get some help. So either way, we'd love to have you. I think, do you have the phone number for the information?
Yep, and that'll be right under the video here. So
yeah, please don't hesitate to call. I'll let Casey know that this is happening. She's one of our ladies at the front that schedules all the neurology stuff. But I'd love to talk to you and spend more time just learning and see what we can do to help. So
that's awesome. Thank you for doing that.
yeah, and thank you so much for this summit. I was super excited about it, and I think you and Dr. Schmo, it's just so cool. So thanks for having me.
Yeah, thank you. And thank you everyone who's watching. Just remember, you're not alone in brain injury. And also, if you're not able to catch all of these live, you do have the option to purchase all of the recordings for $29, and a portion of those proceeds go directly to the Brain Injury Association of America. So thank you all for watching, and we'll see you all next time.
Thank you.